All parishes have recorded dengue cases, with Kingston and St. Andrew reporting the highest number of cases year to date. However, when the cases are assessed by population, St. Thomas, Portland, Kingston and St. Andrew, St. Catherine and Hanover have the highest rates. The 15 to 14-year-old age cohort continues to be the most affected. So younger persons. And the explanation for that is that this is the population that is least exposed to this particular strain. Just for public education purposes, there are 4 strains. It must be noted that while Jamaica has seen continuous local transmission and the dengue virus since 1977, the presence of the type 2 strain has not been identified in the population since 2010. So the older population would have been exposed, the younger not so, and they become therefore the most vulnerable because it is a novel strain for them. I'm therefore using the opportunity again to urge parents to exercise vigilance with their children and teens and to take the necessary action to reduce the incidence of dengue among this vulnerable population. I will also say for those with compromised immune systems, including the older population, they should also be careful of the virus. In terms of the mitigation plan, which has already been triggered and spoken about, the Ministry and the regional health authorities have made the necessary preparations for a possible outbreak, and we had spoken about it prior to the outbreak being declared. Since 2019, the government of Jamaica, through the Ministry of Health and Wellness, has made significant investments in dengue control program. We have spent over 300 million Jamaican dollars in acquisition of vehicles, fogging machines, and the expansion of a number of staff dedicated to the vector management program. Since declaring the outbreak, the ministry has initiated its dengue outbreak mitigation plan, which has the following components: the search and destroy operations, clinical management, workforce management, surveillance, and public education. The aim of the plan is to reduce the impact of the dengue outbreak on the population. Approximately 500 temporary vector control workers have been engaged and deployed across the island to high-risk communities, along with some 213 permanent workers. An additional 600 temporary workers are now being engaged, so we're actually hiring temporary workers to increase the search and destroy and health education component of the response. Since July 2023, the parish health departments have been engaged in enhanced fogging and treatment of breeding sites. This has resulted in a 7-day extended work week for fogging and other mosquito eradication activities by the team. We are currently addressing the high-risk communities, and we remind the members of the public to support fogging exercise and to welcome workers in their communities. On a note of caution, although most persons should not be affected, persons with respiratory or other health challenges are asked to use a damp, wet cloth to cover nose and mouth to avoid any adverse effects during the fogging exercise. We are also working with physicians in health on the treatment protocol for dengue, especially severe dengue. We are examining our inventory of drugs, commodities, and management of blood and blood products. We have launched a number of blood drives just to ensure that we have supplies for those who may need it. The ministry has extended hours for all type 3 to 5 health centers to 8 p.m. This is to facilitate people visiting these facilities to receive treatment and referrals where necessary. At the same time, children under the age of 18 years old who visit the University Hospital of the West Indies will not be charged a fee or be required to pay for services at the facility. Our National Health Emergency Operations Center, as well as the Health Emergency Operations Centers in all parishes, have been activated. These will provide critical surveillance information as well as manage interventions in high-risk areas. The ministry has also developed a public information program that includes targeted messages related to search and destroy action around homes and places that have high density for human interaction, on how to protect children, warning signs for dengue, how to treat dengue, and the types of drugs to be used and personal responsibility around dengue mitigation in our surroundings. A critical part of our mitigation plan is forging partnerships, and so we are collaborating with agencies and ministries, the Ministry of Education and Youth, the Municipal Corporation, the National Works Agency, Solid Waste Management Authority, the regional teams, and NWA. The regional teams from both my ministry and the Ministry of Education and Youth have met, decided on several actions, including meeting of school principals for greater collaboration, training of school personnel in search and destroy action, and the removal of bulky waste from school properties. Working with the Ministry of Local Government and Rural Development, we have engaged the municipal corporations for the purpose of community-based interventions like drain cleaning, removal of bulky waste, search and destroy operations, and community sensitization. Approximately $96 million have been provided to support mitigation works through the Ministry of Local Government and the municipal corporations. The National Works Agency will coordinate the cleaning of major drains in the high-risk communities, which have been determined by the Vector Unit working with the parish offices, and this will be funded through the National Health Fund to the tune of some $160 million Jamaican. The National Health Fund has also provided $75 million through the National Solid Waste Management Authority for removal of bulky waste, which effectively represents primary breeding sites in communities across the country, and certainly the high-risk communities. I want to remind Jamaicans that dengue is ordinarily a mild disease. Persons get a fever, headache, joint and muscle pains. The illness is often resolved through rest and adequate hydration, along with paracetamol to treat the accompanying fever. However, on occasions, the illness can progress to severe dengue, which can result in organ failure, bleeding, and severe fluid depletion that can lead to shock and, of course, death. Therefore, it is important for persons experiencing fever, vomiting, severe abdominal pain, bleeding under the skin, feeling very weak, or getting confused to seek immediate medical attention. We believe in partnerships, so we are discussing with the private sector and other non-governmental organizations to increase awareness, to garner support for the necessary response to this outbreak. We invite the Jamaican people to join the fight to preserve life and livelihood, to work with themselves in their communities, but also with the authorities around identifying breeding sites and the Aedes aegypti mosquito, and to play their part in terms of addressing the most effective response.